TMJ and bite-related headaches hits close to home for me because I suffer from that as well. I am a big fan and proponent of splint therapy to manage those issues. So, assuming the bite position is good, we don't have excessive wear on the teeth and bite collapsing, which that's a whole nother conversation. These custom-made orthotics, as we call them, help stabilize the joint, take the pressure and relax the muscles, and really alleviate the symptoms dramatically. And we use these while we sleep to help manage and mitigate, and that way that we don't have continued issues and more degradation of the joint as time goes on. Actually, headaches is a great one. So a lot of times people think, well, unless I'm feeling pain here, I don't have a TMJ issue. And a lot of times what happens is this can get masked or protected, but the compensatory muscles will actually carry a lot of the stress up more towards the head and towards the neck area. And so those issues actually are occult or hidden problems associated with TMJ issues. So one of the things that we do differently to help treat TMJ issues is look at it a little bit more holistically. So a lot of times the answer or what's done for TMJ pain is like, we hit the easy button, and the easy button is we just do an orthotic, right? In most cases, there's more going on than just putting a mouth guard in to help with treat the TMJ. So we have to look at what's going on with the function of the bite, how the teeth are lining up, how the jaw relationships are set. Are we having excessive wear and the bites collapse? Do we need to fix that, rebuild the bite position? Do we need to fix the position of the teeth? Do we need to balance the forces? Do we need to equilibrate? Like, there's so many other things involved with managing and mitigating TMJ pain that I think often is overlooked because it's pretty complicated stuff. Yeah, I had a patient. She is a very successful and high stress individual, as oftentimes those two things correlate. And that was, she overall was happy with the aesthetics of her teeth. There's some issues here and there, but she just really wanted to fix this pain and the bite weakness that she was feeling. And so we were able to go through a process of actually rebuilding her bite. She didn't realize that she'd worn her teeth down and everything had collapsed down. So just the act of rebuilding her bite, her jaw position, and stabilizing the joint on both sides took away the issues completely. And so in her case, we actually didn't even need to go into an orthotic. We were able to just use a retainer to help protect things rather than a large mouthpiece because we fixed the underlying issue, which is really her jaw position. So most of us actually don't know what a healthy bite feels like. And the reason for that is we are really good at adjusting, right? We're really adaptable as humans. And so oftentimes as our bite changes over time, and it can start with a filling done and it changes the bite a little bit, and then a crown's done and changes the bite a little bit, and then we're getting wear and it changes the bite a little bit, and things just break down slowly over time, and we just keep adjusting. And then they'll come in and see me and start describing these issues and describing things they're feeling, and not realizing that the impetus and the cause for all of that is actually the fact that their bite has broken down and degraded to the point where it needs to be restored. And so we talk about, okay, can we restore this with orthodontics? Or do we need to look at restoring it with a restorative solution using veneers and crowns and things of that nature? And those are the conversations I have pretty much daily with my patients.